I'd like to really thank KAC for having us here, for inviting us to come to your fantastic 30th anniversary celebration in collaboration with 50 Hoops to talk to you guys about multiple myeloma. And this is an area where we really feel it's so important to bring the information on this disease out into the community, particularly the African American community. So I'm really happy to be here. I'm going to talk a little bit about multiple myeloma diagnosis, and some of the information that I have is going to be a repeat of some of the things that Dr. Emmons has already spoken about, but you know, most of the time it doesn't hurt to hear things twice, and this is pretty complicated information, but I'll go through some of these things pretty quickly anyway. So, a diagnosis of multiple myeloma it can be and usually is a life-changing event because it's a serious disease, especially when folks are newly diagnosed. But over the past few years has been great strides in myeloma and the myeloma community, and by the community I mean the patients with myeloma, nonprofit organizations such as the MMRF, the IMF, and other nonprofits in the myeloma space, our pharmaceutical partners and doctors, hematologists, folks that work in your communities and in the academic medical centers working together. We've made really great strides in this disease. So we've made a lot of strides in diagnosing this disease and also in prognosis, and we've made available a lot of novel agents. Many drugs have been approved. So at this time, because we've made such strides in treatment, multiple myeloma is really becoming much more like a chronic disease where patients are diagnosed, they're treated, they go into remission for a period of time, they come out of remission, their disease comes back, there's new agents to treat them, their disease goes back into remission, and this can last for quite some time. So there really is a lot of hope in myeloma these days. Oh, the down arrow, sorry. Okay, so like I said, we've made a lot of progress. So, I mean, my slide says 10 drugs in the last decade. Actually, it's 11, because we just had a brand new drug approved back in July. So, and that really, no other cancer has shown the progress that myeloma has in having all of these drugs approved in 10 years. We've seen a really great improvement in 5-year survival of myeloma patients and in lifespan for myeloma patients. So we're really making great strides in the disease. Multiple myeloma is the second most common cancer of the blood. There's about 30,000 people diagnosed with myeloma every year, and at any given time, there's usually well over 100,000 people in the United States living with it. But at the same time, it's a fairly rare cancer, and it really makes up only 1.8% of all cancer diagnoses in the U.S. I mean, there's many, many more people who are diagnosed with the more common cancers like lung cancer, breast cancer, colon cancer than there are with myeloma. And myeloma is frequently diagnosed in folks that are older. The most common age that people are diagnosed is in their mid-60s to mid-70s, and the median age of diagnosis is 69. So as Dr. Emmons was telling us, multiple myeloma is a blood cancer, a cancer of the blood, similar to leukemia. And there's these normal cells that he talked about called plasma cells that become cancerous, and they grow out of control in your bone marrow. And what happens is that the growing cells, the plasma cancer cells, they grow so much that they fill up all of your bone marrow, and there's no room for any of the other normal cells to grow in there. And that's what causes anemia, because your red blood cells are crowded out, and it also causes an increased level of infection because there's no room for your white blood cells to grow in there either, and those are the cells that fight infection. So there's many symptoms that patients have. So here's just a picture of the bone, and then you can see the marrow there, here. And then here's these normal plasma cells, and as Dr. Emmons was telling us, they secrete these proteins called antibodies, and when these normal plasma cells are working properly, the antibodies help protect your body from infection. However, when the plasma cells become cancerous, they begin to secrete much, much more of these proteins, and these antibody proteins are very abnormal, and they can't help your body. So it's the secretion of all of of this protein into your blood, as he was talking about, which actually affects your kidneys in this disease. So here's some of the common symptoms of myeloma, as Dr. Edmonds was discussing. The low blood counts, which is